We've got some information about removing gluten from our diet. Let's talk about what happens when you actually do it. Dr. Kalish, can you get withdrawal symptoms when you remove gluten, and how does that work?
Yeah, that's fascinating. That doesn't always happen. Some people feel wonderful when they quit, like right away. Some people don't notice the difference, and some people go through withdrawals like you would expect an alcoholic might go through when they stop drinking. I've seen everything from anxiety, panic attacks, suicidal depression, body pain, I can't get out of bed feeling. Doesn't last that long. I would say all the dramatic effects are gone within 60 days for most people. And
It's still
some
a long
people,
time.
Yeah, you shouldn't be scared because some people just feel better right away too, and you can never really tell exactly how it's going to go.
Dr. Myers, how does that work, the withdrawal? We would assume that if you're sensitive to something and you take it out, you immediately feel better. Why would things get worse before they get better?
So in gluten and dairy, there are things called gluteomorphins and caseomorphins, and they mimic morphine in the body, and they attach to those same receptors. So it's as if you're a drug addict and you are being withdrawn from those drugs. So not everybody has those. There's actually testing that you can do to determine if you have those. So that's why sometimes you're getting patients who feel great right away, and other times you're having the people who are having those withdrawal-like reactions.
And Dr. Sebring, is there anything that you can do while you remove gluten if you do find that you're having, you can use both microphones if you want, if you find that you're having these withdrawal symptoms, is there anything you can do to kind of help you ease the transition?
Well, one of the things I try to incorporate in my patients' regimen is an exercise program. And that's one of the things they can do is to release endorphins. I tell them a story. When I was in medical school, I was to present to the head of the Department of Surgery, who was one of the meanest human beings on the planet. And I was to do one of the most difficult things ever, and that was to memorize. I had about 4 burn patients, children at the Shrine Burn Unit. So I was to stand and present all these patients to him right after lunch. So I was very nervous, 2 hours sleep, typical. But I was asked to, by the physical therapist, as we're being shown through that facility at the hospital, grab this, sit on this machine and kick this thing out as hard as you can and bring it back as hard as you can. And the harder you did it, the more it resisted. And I thought, well, this is going to be a diversion. So I did as hard as I could for 1 full minute. I didn't care after that. It was amazing, the results. And so there's things that we can do. You can do parasympathetic breathing, where you breathe in to, a count of 5, or breathe in count of 4, but out to count of 6. And that slow exhalation will cause a calming effect. And so there's different things you can do.